Botulinum toxin injections into the bladder wall can be carried out when drug treatment is ineffective. The aim of this film is to demonstrate how to carry out this type of procedure using the bony injection needle. The procedure will be presented by Professor Gilles Carcenti. He works at the La Conception University Hospital in Marseille under the supervision of Professor Coulange. He'll outline equipment required for the injections and demonstrate the procedure for carrying out injections in the detrusor muscle. Botulinum toxin can be injected into the bladder wall using either a rigid or flexible cystoscope. Hello, we've been treating patients with intravesical botulinum toxin since 2004, initially as part of clinical studies and subsequently as a center of expertise. The main indication is patients with a neurogenic bladder, primarily those suffering from multiple sclerosis or post-traumatic paraplegia. Injecting botulinum toxin into the bladder wall has a number of effects. It reduces the bladder spasms which are observed in neurogenic bladders, in particular in cases of multiple sclerosis or spinal injury. And it also reduces the sensation of urgency felt by some of these patients who have retained sensitivity. We use the Coloplast bony needle to inject botulinum toxin. This is the first purpose-designed needle for injecting the toxin. Its fine tip, which is short and has good penetration, is ideally suited to its intended purpose of injecting into the bladder wall, into the detrusor muscle, without risk of perforation. The needle is available in two lengths, one designed to be used with a rigid cystoscope, which makes it easy for a single operator to carry out the injection. The operator holds the endoscope and the needle to which the syringe is connected. The longer version of the bony needle is designed to be used with a flexible cystoscope, but can be used with a rigid cystoscope nonetheless. The greater length allows for increased flexibility in application, such as enabling an assistant to carry out the actual injections. The length of the bony needle tip measures 4 millimeters and is fitted with a depth stop. This is specifically designed to allow total control over the penetration depth of the needle into the bladder wall, so limiting the risk of perforation. The treatment of neurogenic bladders with botulinum toxin is at present the only recognized indication with a marketing authorization. The prospects opened up by the therapeutic success encountered in neurogenic bladders are primarily applications to non-neurological patients suffering from clinical overactive bladder syndromes. At the present time, a number of studies are underway at a national and international level to confirm this indication. We are greatly looking forward to hearing the results from these studies.